Good evening, everyone. Hope everyone is warm in this cold weather. I'll just go straight to it. So, today's presentation is about intergenerational patterns of addiction. And what we'll be discussing mainly is what happens to the family when addiction becomes part of it, and what are the effects of family trauma on children, as well as what happens when adult children of addiction have their own family members as well, or like build families. And just going straight to it, I think it's important to also realize that research has indicated that too often alcoholism and other drug addiction becomes a family legacy. And research has indicated that more than 50% of today's addicted children are children of alcoholics, and there are millions challenged by other problems that result from alcoholism or drug addiction in their family. So already that's telling us that that's a very huge amount of families that already have issues that are going on, and obviously not resolved, and that obviously has a huge impact on children. And there is this quote that says, "You can't heal it until you feel it." So this quote encompasses the concept of intergenerational addiction and trauma, which means that trauma and addiction can be passed down from one generation to another until someone recognizes it, decides to confront it, and heal it. And I think it's also important for us to realize that when one person in the family chooses to heal, that person or those particular people can be regarded as the cycle breakers, because you're literally making changes for the next generation. And I know it can feel tough, and because obviously when that happens, it means that you're carrying a weight as you break those cycle. But I think I'd like to encourage everyone, even family members, to honor those emotions along the way and take it and at their own paces as well. I think that's really important. And I think just to break down the concept, intergenerational pattern of addiction, in terms of what it means. So it actually means that it's the tendency of the addictive behaviors or substance abuse issues to reoccur across generations within families. So this phenomenon, I think it's important for families to realize that it can stem from a variety of factors, including genetic predisposition, learned behaviors, environmental influence, which will be discussed more during the course of the session. And the first one, we will start with what happens to the family when addiction becomes part of it. I think it's important for us to realize that families where addiction is present, oftentimes painful. It's oftentimes painful to live within it. I mean, when addiction is now present, it's very, very painful to live within it. And I think that is why it's important to also realize that when that happens, there's then broad swings um, of emotion, and broad swings from one end of the emotional, psychological, and behavioral spectrum to the other, characterize the addicted family system as well. And I think also it's important to also recognize that living with addiction can put family members under unusual stress. Normal routines are constantly being interrupted by um, unexpected or even frightening kinds of experiences that are part of living with addiction and drugs in the family.
Sibongile, before we move on to the next slide, I just want to add to that. So, addiction is often defined as being a family disease. And I think what you're speaking of here explains that quite well. So even though one person in the family might be the addict or might be the one using, they're part of a system, and that whole system gets affected. People adjust their behaviors, people get affected emotionally, psychologically. So there's a whole lot of change that happens within the family system, and different family members deal with it differently. But that is often why we say that addiction is a family disease. One person uses, but so many people are impacted and affected by it.
Yes, and also just adding on to that, Roxanne, I think it's also important for families to realize that, even as you explained that addiction is a family disease, and that if one person in the family or in the system is affected, the whole system becomes impacted. As I've said earlier, I think it's important for families to realize that if they are aware that there is a problem that exists in this system and it's not addressed, then it can be passed down to other, you know, generations. So it's really important for families to pay attention, even if it means that maybe your grandfather was using and something that was like just left, and it's something that has to be addressed because it's very important. If it goes
Sure.
unaddressed, then there is a possibility that it can affect the upcoming generation. So the
100%.
problem and the system, I think it's also important to understand that the entire system becomes absorbed by the problem, as you've already mentioned, Roxanne. And that problem is also slowly spinning out of control. And when that happens, little things become big and big things get minimized as pain is denied and it slips out sideways. So it's also important that during early childhood years, living in these intense emotional environment can set up a fear of feeling or patterns of attachment that are filled with anxiety and ambivalence. So I think it's also important to just realize that the impact that has from as young age or an individual as they're young, it impacts them, and it in adulthood then it plays out differently as well. And I think one can also wonder, how is the family's ability to self-regulate challenged? I think it's important to understand that tense family atmosphere leads to emotional disconnection of families, in a sense that obviously the family loses its sense of what is normal. And family will generally reach as a unit to try to balance itself, but it becomes difficult when there is addiction already in the family. So another thing that's important to also note is that in alcoholic homes, this may become a dysfunctional sort of balance, even if obviously they're trying to balance whatever that's happening in the family. And family members can also become consumed by this disease called addiction, to such an extent that, as I've mentioned, that they lose the sense of what is normal. Their life become about the life becomes just about hiding the truth from themselves, their children, and their relational world as well. So that becomes a norm, the new norm rather. And I think it's also important that when that happens, trust and faith in an orderly and predictable world can be challenged as their family becomes chaotic as well. Promises are broken, and those that are dependent, obviously, they don't know also how to regulate because the system becomes dysfunctional as well. And when that happens, then, given that there's chaos, broken promises, and there's this lack of trust that is existing, it becomes very difficult for kids to exist in such a system. Um, whereby parents are not even present and are not doing their roles accordingly, then kids then become parentified, meaning that kids may take roles of an adult as an attempt to try to provide care and comfort that is already missing in the system.
Mm.
And I think just in relation to how the family becomes organized around trying to manage this unmanageable disease of addiction, it's important to realize that while families attempt to become, organized around trying to manage this manageable disease of addiction, they may yell, withdraw, they may also criticize, try to understand, get fed up, you name it. But they become remarkably intensive in trying everything they can come up with to contain the problem and keep the family from blowing up. But the alarm bells in this system are constantly on low, and it also causes everyone to feel hyper vigilant, which means that they become so ready to run for emotional or physical shelter, or to even erect their defenses at the first time of, getting that sign of trouble.
Sure.
So it becomes such an unsafe and like scary environment when that happens, because we know how unmanageable this disease of addiction can be. So, in terms of how families um, become system of manufacturing and perpetuating um, trauma, because family members avoid sharing subjects that might lead more to pain, they often wind up avoiding genuine connection with each other. That's the first thing that we should know. Then, um, when those painful feelings build up, they may rise to the surface in emotional eruptions, or get acted out through impulsive behaviors. So that's why it's important to also understand that you, as maybe an elder in the family, keeping these things or not like communicating or sharing such subjects in relation to addiction history, it's as much, or it's the same as just keeping this elephant in a living room. And you also have to realize that it increases in size and force, and the family must become ever more vigilant in keeping its strength and power from overwhelming their ever awakening internal structure, because then they're always trying to make sure that this big elephant does not come out. So it becomes even more difficult. But then it also means that they're engaged in a losing battle, because eventually, if something is like genetic, it always going to come out somehow. So, in relation to also how trauma and addiction affects both the mind and the body, it's important to realize that intense stress can lead to dysregulation of the limbic system. So, this is the system that helps to regulate our moods, emotional tone, appetite, and sleep cycle. So, obviously, if this limbic system is then not functioning the way it's supposed to function, it means that a child or like an individual is not able to function or do daily living tasks accordingly. So problems regulating the emotional inner world can lead to impaired ability to manage levels of fear, anger, and sadness, resulting in chronic anxiety, depression, substance abuse, and even eating disorders. So I think also with that being said, it's also important to realize that when there is eruptions or already addiction in the family that is happening, the child becomes burdened. in a sense that, you know, children is finding it difficult to handle whatever that's already happening in the environment. So children from these families carry burdens into adult roles that cause trouble in their relationships, um, or work lives even. So symptoms related to being a child of addiction emerge in adulthood. So that's what I was talking about earlier, that usually you won't see the results immediately if the child isn't impacted by that, but only later in their adulthood life that's showing up. So the traumatized child lives in frozen silence until these frozen feelings emerge in adult action and words as they search for a place to express unprocessed and you know, unspoken pain. And I think we often see that in therapy. You also agree with me, Roxanne, when everything
Mm.
starts to unleash.
Sure. Yeah, we see it in many different ways.
Mm,
Um, you know, I keep thinking back to one of the previous slides that you mentioned where you spoke about that balance. Um, so the scales have been tipped because of this addiction, and the families try their best to kind of tip the scales back, and often that's done in unhealthy ways. So, you know, we try and rescue, or we enable, or you know, we keep secrets. But there's so much of that, or you know, it's like, okay, just don't upset the addict because there's going to be an explosion. So, you know, we learn not to voice our feelings and not to voice what we're feeling and where we at. We learn just to keep quiet, don't rock the boat. So there's so much of this behavior that we learn, and I think this one explains it quite well. So if you're a child growing up in a family where there is an addict, there's a lot of I almost want to say the less obvious signs that we carry forward into adulthood, which then affects us emotionally, I believe, but also, you know, our relationships going forward. So yeah, it's the impact is quite vast.
mm, mm. And I think it's important to also realize that, you know, trauma in childhood can seriously impact development of an individual, a child, throughout life, and can have pervasive and long-lasting effects. For instance, there are certain parts of the brain that, you know, are associated with when someone is like startled or is in an environment that is like unsafe, and you know, certain parts of the brain, like for instance the amygdala, which is the center um, for the flight and freeze response, is fully functional from birth. So this basically means that the baby is capable of full-blown trauma response, and the hippocampus, which is the part of the brain where stimuli is assessed as to whether it is threatening or not. So this part of the brain is not yet fully functional until the age of 4 or 5, and the prefrontal cortex is not fully mature until the age of 11 or older. So what this means is basically that when a child is frightened, they have no way of understanding what is going on around them. So they do not have the developmental or cognitive capabilities of assessing frightened stimuli for its level of threat. They also need an external modulator, like a parent or a caring adult, rather, to help them regulate themselves and calm them as well. So it's also important that to notice that without this help of a parent or um, a caring adult, you know, this painful stimuli may become locked in a sensory memory that lives within the self system without insight, understanding, and regulation. So it becomes trapped, basically. And we also have characteristics of um, an adult child of trauma and addiction. So we'll see, for instance, with the following characteristics, which is learned helplessness. So with learned helplessness, a person loses the feeling that they can affect or change what is happening to them. So you learn that, there's nothing I can do, basically. They give up and become helpless in other ways. So this learned helplessness can affect, obviously, someone's different areas of life, because then they're not able to be as resilient and believe that, there's actually other alternatives that I can try besides this one. And there's also what we call emotional constriction, which is numbness and shutdown as defenses against overwhelming pain, and restricted range of affect or lack of an authentic expression of emotions. So there's that constriction that exists as well, even if there is this overwhelming pain that someone is experiencing. There's also what we call distorted reasoning, which is just that attempt to make sense and meaning um, out of a chaotic, confusing, and frightening or painful experience that feels senseless. Like for instance, for a child, with regards to distorted reasoning, they will see maybe mom and dad fighting following being intoxicated or during the intoxication period, and then they will try to almost want reason to justify that for parents, that okay, probably dad was beating mom because of these reasons. So that is distorted reasoning, because in the first place a child should not be exposed to such an environment. And then we have also what we call loss of loss of trust and faith. So this is due to deep ruptures in primary and dependency relationship and breakdown of an orderly world, basically. And we also have traumatic bonding as one of the characteristics. So this one, we see it a lot. It's unhealthy bonding style resulting from power imbalances in relationships and lack of other sources of support as well. So we'll see two people who are from both traumatic family backgrounds. It becomes easy for them to want to be together. And I think we see that a lot, Roxy, with our patients as well, where they would want to form exclusive relationships, not understanding that already they're dealing with this disease, and they're from different background. Not saying that maybe they're from backgrounds of like addiction or whatever, but they already have other things that they're dealing with. So if they are to come together and be in a relationship, it's almost going to be dysfunctional until obviously they get to a point whereby they're able to resolve all the traumas that they went through. So it's really, really important. And we also have hypervigilant and development of rigid psychological defenses. And the defenses, some of them, I think, we hear them a lot, minimizing addiction, intellectualizing, um, projection of emotions, denial, and like splitting as well. And in addition to that, another characteristic is high risk behavior. And I think in addition to that, I think you can move, Rox. You might also wonder what happens when a child of trauma and addiction have their own families. So when adult children of or enter an intimate relationship in adulthood, the feelings of dependence, I think it's important to realize that and that when they do get into those intimate relationship in adulthood, their feelings of dependency and vulnerability like forms part of like it's a very like integral part of any intimate relationship, and may make them feel very, very anxious because obviously they're coming with this background of unresolved trauma, and having to get into a relationship, it can be really hard as well. Because you almost have to understand that you're coming with your insecurities, you coming having observed certain things from your family members. So you're almost getting into that space or a relationship with like preconceived ideas or suspicions as well. So they can be very mistrustful and suspicious, may have difficulty being vulnerable within intimate relationship. They become so closed up because they already have like these preconceived ideas that, okay, probably something bad is going to happen. So feelings of danger, chaos, and rage as well as fear can be easily triggered and inappropriately expressed as well. So there's this, term that says, someone can be a time ticking bomb. So I think children from families where they've been like exposed to trauma and addiction, they become time ticking bombs, for lack of a better word, because then it's almost like they're waiting for something to happen or to trigger them, so that all those emotions that have been repressed come out. So they may lapse into people pleasing in order to alleviate potential danger. I think it's important to note that as well. So one might also wonder, how do we break the intergenerational patterns of addiction? So I think for families, it's important to understand that, secrets should, be broken, for instance. So do not keep family secrets. So each descendant has a right to know their health history. If grandmom or granddad was using, I think it's really significant and important to mention that either to your grandchildren, or like obviously you'll wait for a certain age where you feel it's appropriate to like inform them of that. So it's also important to be honest about your struggles, your own struggles as a parent, with alcohol or drugs. So it's also important to understand that just as children may mimic negative behavior, they can also learn valuable skills, life skills, through your journey of addiction, for instance, and wellness as well. So if you are someone who's already working on yourself, you're aware that, okay, I'm actually struggling with this, they can also take them within themselves, because obviously we know that children learn from seeing their models, which is their parents doing something. They can really understand that actually when I do have problems, perhaps going to therapy and finding better or adaptive coping mechanism rather than going to alcohol is something that I can choose. And I think also uh, in terms of how to break this intergenerational pattern, you have to also recognize the patterns of abuse, or domestic abuse that is already existing in the family, even patterns of addiction that is already running in the family, so that you can address it, and that way you avoid it. You avoid passing it to the next generation, because then you're giving yourself an opportunity to work on it. You're basically saying that I'm going to be the cycle breaker, so that it doesn't affect my children and my great grandchildren as well. So family therapy provides also a safe space for communication and healing, allowing family members to explore underlying issues, improve communication skills, and develop adaptive coping mechanism as well. So those are some
Sibongile, I
of
just
the,
want to add,
yeah.
sorry,
Mm.
I just want to add one thing before we move to the next slide. On point number 3, you said to recognize the patterns of abuse, domestic violence, mental health disorders, broken relationships, or addiction. But and I think you've spoken about it quite a bit in previous slides, but to also recognize those maladaptive behaviors that we take on and that are also passed on from generation to generation. Those beliefs that we carry with us and the behaviors that we have to try and deal with, whether it be trauma or addiction or whatever it is. So to try and recognize those and to try and change those as well.
Mhm. Thank you, Roxanne. Definitely agree with you. And I think just trauma and addiction is an intergenerational disease process. Children of addiction, according to research, are 4 times more likely to become addicts themselves. Obviously, like other things that I've mentioned, that the environment plays a significant role, and kids learn by seeing, that learned behavior concept or characteristics as well. So it's important to recognize that, and also the emotional, psychological, and behavioral patterns that get passed down through the generation put each generation at risk for perpetuating the trauma and addiction even further. So I think here we just like seeing rocks that cycle, if it's not broken, or if there isn't one member of the family trying to address it, unfortunately it's gonna go down to other generations. And unfortunately, it might be even much more uglier when it's passed down. So
Sure.
this gives us an indication of the need for a rigorous program, treatment, and recovery for addicts and all family members. So this is what we have at Changes Treatment Center, where we get to have settings like this, family support, and I think family therapy is also recommended, very important to just for family members to be able to express and share those secrets, so that the elephant in the room is not hidden anymore, and it doesn't grow big in size until one family member or the next generation gets to almost want to break that cycle. Group therapy, we patients are able to express themselves, their emotional difficulties, whatever struggles that they're going through. It is a safe space for them. Individual psychotherapy, OT as well is very important, and they're able to also get psychiatric intervention as well, which is really important, so that you're able to be stabilized with medication as well.
Sibongile, I just want to touch on the group therapy. So
Mm.
I think a lot of these things that we've spoken about is also learned behavior, that we carry over from generation to generation. And, you spoke about our family like being the first place where we learn. We learn about life, we learn what is right, what is wrong. And that just becomes part of our belief system. And so often we're not even aware of the fact that it might be flawed or there might be something wrong. And I think that's the beauty of group therapy as well. Group therapy is great at helping each other see those blind spots, those areas that we are not able to see. Whether that be by relating to someone and saying, okay, wait, I kind of relate to what you're sharing. And, maybe there's some truth in it in my story, or somebody hearing something that, someone else is sharing and then saying, okay, but have you ever thought about it like this? Because this has been my experience. So yeah, I think group therapy in general is fantastic, but especially when it comes to these learned behaviors and these things that we've picked up over years that have been carried over intergenerationally from one generation to the next.
Mm-hmm. And I think just adding into that, Roxanne, I think it's so incredible. I think having to obviously experience, all our patients having to relate to one another, but also understanding that group therapy is a safe space. I don't feel
Mm,
alone. I have
sure.
people who are also having a similar problem. So they're able to almost
Mm,
dissect everything and process all these difficulties, all these traumas
mm,
that they have experienced as well in their different backgrounds.
sure.
So I think it's also important, just in closing, to understand that pain travels through family lines until someone is ready to heal it in themselves. and that by going through the agony of healing, you no longer pass the poison colors onto the generation that follow. It is incredibly important and sacred work.
I like that. I think that is so, so powerful. Um, and yeah, I think it's important to get to that place where someone says it stops here, I'm not allowing it to continue. Um, and just, that description of going through the agony of healing. We often say to the patients that are in our care, if you do this properly, it's probably going to be one of the hardest things you're ever going to have to do in your life. It's not easy. It's not easy making yourself vulnerable. It's not easy exposing yourself. It's not easy, admitting some of the things that you've done and the things that you've been through. But yeah, I think, if we don't, then this poison chalice is just going to be passed on from the one generation to the next. So
And I think,
very, very important work.
thank you so much, Roxanne. And I think it's also a reminder, like I always say, that it's important for you to choose your heart. Not doing anything about a problem is hard, but also dealing with the problem. It's
Mm,
also hard. Even recovery
100%.
is also so hard, but you have to just choose which heart is it going to be for you.
I like that. I like that. I think we often share with our patients as well that recovery is hard, but regret is harder. So, like you say, choose your hard. They're both hard. And
Mm,
you need to choose which one you're wanting to live with.
mm,
So, yeah.
definitely.
Great.
And
Thank you
I
so much, Sibongile.
thank you.
Is there any questions from anyone? If you have any questions, you're welcome to raise your hand, or alternatively, you're welcome to just type a question in the chat room.
Or maybe while questions are coming, I think this is open to any family member. I think it would be interesting to also hear. So I have a question for all family members that are attending today, just in relation to obviously the presentation. I think just to also get a sense of what is it that is happening family in our family dynamics, and just how do we communicate. So I have a question that says, how open is the family or our families in discussing addiction related issues
I like
just
that.
within our families? I think it would be interesting to hear. I think that's why family supports are really so important, so that we get to share our experiences and what has been working for us. And I think I also like what you said, Marilee, just in relation to being open with addiction, and how it has it's impacting family members. And I think I just wanted to also indicate that talking to other family members about addiction, it can also be a transformative process on its own, because not only does it promote healing, but it also just strengthens those familial bonds and resilience as well, because then you get to understand what your family members is going through. You're able to support them better as well, because there is that communication that is already um, existing. And I think it just also helps families to be able to confront challenges together, and also just learn from past experiences as well, while also making sure that they're working towards healthier and a more supportive future.
Mm. Uh, Sibongile, I think, and maybe you'll agree with me, but sometimes those initial conversations are particularly difficult. I think they're so emotionally loaded.
Mm,
There's hurt, there's anger, there's frustration, there's fear, there's so much of that. But that's okay too, because that's where people are at, that's where family members are at, and it's okay to have
mm,
those emotions, and it's okay to share those emotions. Um, whether it be in conjoints, whether it be in those initial documents that we send out where we ask for some collateral information, whatever it is, while your loved one is receiving treatment, you also need to heal. And yeah, again, Mill said the more she learned and the more she spoke, the easier it became. And I think that's been our experience too. The more that we do trust, and we start sharing and we start opening up, the more healing does take place. So we've got two
Definitely.
questions in the chat room, Sibongile. The first one is from Christian, and he says, in our family, we do discuss this extensively. Our question is more whilst in therapy. The lines are so blurred for us, pertaining to acceptance, love, calling out lies, etc. Fine line that makes it hard to do the so-called right thing. Also, we do not necessarily want to keep on revisiting all the trauma that played a huge role in our loved one's addiction. When do you stop or continue? Can I give that one to you first, Sibongile?
Just like going through it quickly.
No
Because
problem.
it's a bit of a lengthy one. So, if I'm understanding Christian correctly, are you asking when do you stop, talking about the trauma, or what exactly that led to the
So
addiction? Yes.
my understanding of the question, and Christian, please correct us if we're wrong, but it's so while the loved one is in therapy, how many times do you kind of bring up the trauma and the bad stuff and call them out on the lies, and the things that have disappointed you? So to what extent is that therapeutic, and when does that kind of become counterproductive almost?
Hmm.
So
I missed you.
when do you stop and when do you
there.
know when to continue?
I missed you there. Sorry, Roxanne. I think my network is bad this side. Please repeat that again.
Sorry. Okay, so I said my understanding of the question, and Christian can correct us or correct me if I'm wrong, but it
Mm.
is to what extent and to what point do the family need to speak about the lies, the traumas that they've experienced, the hurts, the disappointment? So to to what point is that therapeutic, and when does it almost become a bit counterproductive? So when do they stop and when do they continue?
Okay. Okay. Okay, I think that's such a good question. And I think
Mm,
we once had a presentation on that because with us basically saying that it's important to have those open conversation just in relation to addiction. It doesn't necessarily mean that you constantly have to remind a loved one of how much they lied, how much they've stolen, and how much they behave. I mean, there will be obviously a time for that, like for instance, conjoints you mentioned, Roxanne, where families have to express how they were emotionally impacted and the behaviors that played out. But and you also add on that, Roxanne, I do think that after that, it wouldn't be like beneficial for the patient when they're home and they're doing a little mistake to be constantly reminded that you're a liar and all those things, because it can trigger a possible relapse. I'm not saying that that would happen, but it might trigger certain emotions, if I can put it that way, that are unpleasant. But I think it's yeah, I think from my side that's what I think, that
mm,
maybe on the initial stages and with time when the patient is in recovery and they're doing well, and maybe they're doing mistakes, because even if you're in recovery doesn't mean that you won't do mistakes. And doing mistakes, I'm not saying going back to using, there would be mistakes that they would be doing, and you don't have to constantly remind them about the past, because that
mm.
might be disruptive to their process.
So I agree with you, and I think a lot of time it has to do with the motivation. Why are we bringing this up, and why do we keep
Mm.
re-entering? Is it because we do feel like our loved one is being dishonest and is not being open during the therapeutic process, and that we need to bring a lot of things to light and make them aware of things and how things impacted us? So, or is it because we're hurting and we kind of want to hurt back? Because I think we do see that often too. And again, while that hurt and those feelings are valid, we need to be careful how we deal with that, because it can be constructive to the therapeutic process and to your own healing, or it can be destructive, again, both to your loved one in treatment, but also to yourself. So I think when it comes to a loved one that is currently in treatment, speak to their counselor, speak to the therapeutic team, maybe discuss some of those things with them. And, you know, the counselor can also advise on whether that's something that we are aware of, that your loved one has perhaps maybe shared on already, or whether that is new information, and perhaps on how we can deal with that going forward. Because, you know, a lot of times we do value the family's input, and we need that input. You know, yeah, we don't know everything that's happened in the past, and we do trust them to bring a lot of that, but sometimes there is a lot that's not said. So that information does help.
Yeah,
So
I
we've
think
got 4 more questions. So I just want to run through the next ones. Christian, please let us know if that has answered your question, or if you need further clarity on that, please.
I think she did
The
indeed.
next,
Yeah. Mm.
okay. All right, there I see it. Um, so Peter has posted, I'm scared to speak about alcohol in front of my life partner because I'm scared he goes out. What do I do?
Yeah, I think also just on that, Peter, I mean, we do also understand that you coming out with alcohol is probably something that is probably embarrassing, or like can bring a lot of shame as well, and possibly um also a partner leaving. But I think it's also important not only for you, but for the relationship with her as well, because you not expressing that or sharing that, how is that also helping? Because you are now sitting with this guilt. So sometimes sharing it, can be helpful. And I think you sharing it with your partner, you'll be able to get that support as well in terms of how to navigate it as well.
Yeah, I just want to add to that, Peter. So I think there needs to come a time during this recovery process and during this journey where we shouldn't be scared to speak about those things out of fear that our loved one will go and use or will go and relapse. You know, there is a fine line. We often say to the patients in treatment with us that they shouldn't, you know, get caught up in euphoric recall or romanticizing or glamorizing the drugs. So I think that kind of talk is dangerous. But at the same time, when we have certain topics that are complete taboo, or we feel like we need to walk around on eggshells, I think there's often something more that needs to be addressed there. That's not the way it should be. We should be able to have healthy conversations and open conversations with our loved ones.